give it a couple more minutes for folks to join. Okay, everybody, I think we're going to get started. Welcome, everybody, to the next Brown Bags seminar series for Small Firm Exchange. Bag series will be discussing ways to safeguard the investments you have made in your business and professional practice with options for health insurance and general professional liability insurance. Today's speakers are Monica Kendall and Melissa Roberts. Just to give them a brief introduction, Monica Kendall is an insurance professional with Healthcare Solutions team. Her mission is to eliminate the uncertainty and anxiety surrounding the selection of insurance products that safeguard your health, family, and livelihood. She prepares comprehensive options, empowering you to make well-informed decisions. Representing an extensive range of major insurance providers such as Aetna, Blue Cross Blue Shield, Humana, United Healthcare, and more. She is committed to delivering clear and unbiased guidance on the policies available and matching your unique requirements. Monica is your advocate for your health insurance needs, locating providers, assisting with claims, resolving billing issues, consulting on new plans, or evaluating insurance options as your circumstances evolve. Our second speaker today, Melissa Roberts, helps design firms avoid claims, manage their risk, and purchase professional liability and other business insurance. She is past president of AE ProNet, a national organization of architects and engineers insurance brokers. The American Institute of Architects Northeast Illinois chapter awarded her their service award for outstanding affiliate member. And her articles, The Big Switch, Looking Before You Leap When Changing Insurance Companies and Reporting Claims and Potential Claims Under Professional Liability Insurance, were published by AI Architect. Melissa currently serves on the ACEC Illinois Risk Management Committee and is a past Northeast Illinois Chapter AI board member. Melissa regularly presents risk management seminars and workshops on behalf of clients, professional associations, and educational institutions. With that, we're going to let Monica start us off to talk about health insurance.
Thank you. Hi, everybody. I'm Monica Kendall. I am going to share my screen. I got a little deck to discuss the basics of health insurance for your small business or your individual situation. By all means, keep your questions in your mind, and then at the end, if you have anything specific, we can definitely go over it. All right. Can everybody see that? Are we good, Jason?
Yes, looks good.
Okay, fantastic. All right. So being self-employed, is a little bit trickier. You're not, you can't just turn your mind off and let your employer figure out your health insurance situation. You got to do it for yourself. And there's, having been a small business owner before I became a health insurance agent, I stumbled over a couple of the oopses myself. So just on the basic side, there's three main categories of health insurance. Group health insurance, which is through an employer. You have a limited amount of choices within there. Oftentimes the group insurance is going to have the employer paying a portion of the premium, you pay a portion, and your portion is going to be tax advantaged by being a pre-tax deduction. An individual health insurance policy can be a couple of different things. Most people are familiar with the under 65 market with Obamacare or the Affordable Care Act, whatever you call it. And I've got a couple other options to show you while we're under that heading as well. And then Medicare. Medicare is at age 65. Everybody who's worked at least, I think, 40 months in their working history gets Medicare from the government. And then you need supplements because it's not full insurance. So those are the three main pieces of it. And just starting with the group insurance, the traditional group insurance you can get for a company that has anywhere from 2 to 50 full-time employees with no penalties for not offering group insurance. Anything over 51 full-time equivalents. If a group doesn't offer a health insurance plan, that group can be penalized. Okay, so that's something that came in 2013 when the Affordable Care Act started up. So then the 51 and up group needs to offer a group health insurance, and it needs to be considered affordable. And there's a lot of details how that gets figured out. But I think for our purposes today, we're going to focus on the small group. Again, there's no penalties for not offering it, but you do have the ability to offer it. And there's two ways you can do it. One is traditional group. In Illinois, we actually have the ability to, as long as there's 2 employees, and one can be a 1099 now, and one can waive off, Blue Cross Blue Shield will still put together a small group plan for just the one employee that's actually wanting it. So there's an opportunity there. The other thing is something called self-funded or level-funded group plans, and you can offer those 2 or more employees. We do need to have a minimum of 2 on the plan. The opportunity with the self-funded is that now you can bring in health questions. So a questionnaire is put out to all the employees who are going to apply. They on a private website, they're going to drop in the answers to those health questions, and that group gets underwritten based on their health. The opportunity there is if you have a pretty healthy small group, you can probably get a really nice plan for sometimes a third or half of what a premium would be on a traditional plan, traditional funded plan like a Blue Cross plan, because those are strictly rated on the overall group, your ages, and your zip code. Nobody's health is considered in that situation. It's just a flat rate on those zip codes and those age groups. But that's an opportunity. If you have a healthier group, sometimes it's really worth looking at one of these self-funded groups. And the other opportunity there, possibly less from premium, but is if the claims bucket, so it's always filling up a claims bucket within the given year. And if there weren't any claims, then the group can get an overall refund for that claims bucket, what's left over, which is kind of nice. There's also something called a defined contribution plan. So in that situation, a group offers an third-party administrative plan where they say, we are going to offer you $250 a month to help pay for your health insurance. You go out and get your own individual policy, show proof through this third-party administration website that you have it, and then we will reimburse you tax-free for that $250 every month. Okay, this is kind of a nice situation. It may be a little bit more complicated. There is a cost for having the third-party person do it, but I have some small groups that have liked it and have done that too. The other reason that they seem to like it is because it has the ability to split different contributions for different job classes. So for instance, I have a landscaping group that does this. So their landscaping folks get $250 a month, but then their admin people get $500 a month, that sort of thing. You can do that in that, which you can't do in a group insurance plan. You have to kind of keep the contribution the same across the board. The other thing is if, for instance, in that landscaping group, a lot of those people I helped get an Affordable Care Act plan, Obamacare plan, and they did qualify for a subsidy through the marketplace. You can use that subsidy and the employer contribution together. Okay, so that's another thing that's nice in some situations. Individual health insurance are, like I said, Affordable Care Act, ACA, major medical, Obamacare. And the other is that there are ERISA-based individual plans for individual K-1 or 1099 self-employed people. These are newer. There's some nice plans. I'll go through those too. And then there's something called a fixed benefit indemnity plan, which is not a major medical plan, but for folks who make too much money to get a subsidy through Marketplace and really don't want to look at those and are fairly healthy and don't want to look at those high premiums, it's an alternative. And I'll kind of explain how those work as well. Things to know about an Affordable Care Act Obamacare plan. It's, again, guaranteed issue. Pre-existing conditions are covered day one. There's no holdout. Guaranteed issue means they don't ask any health questions. You just get into the plan and you get it. There's no lifetime maximums. So those in the olden days, some of those plans were limited to $1 million lifetime or 5 million lifetime. And if somebody was really, really sick, that you could really go over that, believe it or not. And the other thing is that all covered essential benefits are mental health, maternity, fertility treatments. Your wellness is covered at 100%. Your drugs are covered on the plan. And then there's always an individual out-of-pocket. The individual out-of-pocket maximum currently is $9,450 for an individual and twice that for a family. It's actually going to go down by a couple $100 next year, which is a first time since the Affordable Care Act started. It's going to go by $200 for individual and $400 for a family. And then the most important thing here is that the subsidies are available to help pay for the health insurance, and it's all based on an income. If your income is higher, you probably won't qualify for the subsidy, but you can always get the plan with or without the subsidy. But if your income's lower, and it's about your taxable income, so a lot of self-employed people have a lot of business expenses that get, pulled across, they might qualify for a subsidy on these plans. Thing to know about the Affordable Care Act is that the open enrollment period, which is coming up soon, it always runs between November 1st and January 15th. If you want a January 5th start, you have to sign up by December 15th, but it does stay open until January 15th, and that would be a February 1st start on a plan. And then it closes up after that. And the only way you can get into an Affordable Care Act plan outside of open enrollment is if you have what's called a SEP, or a special enrollment qualifying event. Qualifying events are these kinds of things: marriage, divorce, death, loss of a job, loss of benefits from a job, a move, birth of a child turns 26, etc., which all of them are variations of loss of other coverage. And then you can move into a new one through the Affordable Care Act with one of those special enrollment periods. So the plan I mentioned, which is ERISA-based, is a individual plan for 1099 or K-1 owners of their own small business, where they don't have to have an employee. You can, but you don't have to. It is America's choice. They call it their gig care PPO plan. Some important things about it is that you do have to qualify based on 11 health questions to get into it for the first time. And once you get it, you can keep it up to age 65. When you're ready for your Medicare, then it will drop off. So it's a one-time get in, and then you can keep it, which is important. So even if somebody gets sick and has something going on, it's a permanent plan. The ones that I sell have access to the National Blue Cross Blue PPO, which is their large network. The Affordable Care Act does not have that large network. They have what's called the Preferred Choice Blue PPO, which is a smaller, mostly Illinois PPO network. So there's not as many providers. And sometimes people like that, like in Illinois, the Preferred Choice doesn't have University of Chicago. And see, Children's Lurie's Hospital. And I have people who want that, so that this would be an access to that larger network. They do offer the Affordable Care Act compliant coverages though. So it's free wellness, maternity, etc. And pre-existing conditions are covered day one. So if you can qualify for it, answer those house questions and get into it, then it basically will function on a day-to-day basis like an Affordable Care Act plan. And then the thing that's also attractive, if somebody does not qualify for a subsidy through Marketplace, the straight up premiums for these are usually 20 to 30% less, okay, depending on where you are. And these plans are available across the United States. And I think only 4 states are not available. So it's kind of a nice, and it is newer. These guys are, earlier when I told you about self-employed, self-funded plans, these guys have been in that market for years, 10 years, 12 years, making small business plans that were 2 or more employees, but they just got the individual group plan for this approved just through the Department of Insurances just like a year ago. So this is pretty new. It's been an exciting new offering, and I've had a lot of small business people like it. A fixed benefit plan, fixed benefit indemnity plan is the other possibility that I mentioned. It's cheaper. It pays benefits on a fixed fee basis. So instead of being against a deductible, and then once you get through your deductible, now it's on the insurance company. This has a set amount per item. So a daily amount if you're hospitalized, $3,000 a day or whichever plan you would pick. It pays that fixed fee amount, whether the bills are higher or lower. So there's no deductible, it pays first dollar benefits, and you do get the network discount. And the one I usually use is United Healthcare's PPO fixed benefit. So you get a really deep network discount with them, and then it'll pay its fixed amount. So it's a different concept. It comes in, it pays what it is, and if there's leftover, that's when you pay. That's where you come in. Again, no deductible. Again, there are health questions to qualify for this, but once you get it, you can keep it up till age 65, just like the other one. And it can function standalone as a standalone plan or as a supplement to a major medical plan. I have had several people buy this standalone, okay? And then something major happens to them, okay? I had a woman, for instance, who had this for, a while, and then she unfortunately was diagnosed with breast cancer. So it stood alone for the next 6 months until we got to the open enrollment. And it did quite well keeping up with those bills, but at open enrollment, we put her on a high deductible Blue Cross plan to back it up. So the next year, when she continued with her coverage, her treatment, it functioned as a very strong supplement plan. So basically, once she hit the maximum out of pocket on the Blue Cross, everything was covered by Blue Cross, but all of the daily benefits that were paid on this fixed benefit plan, now we're going back to her. And in that second year, she had about $25,000 paid back to her because it was a supplement at that point. And she still kept it up to age 65. She's now on Medicare. So even after she was through that treatment, what have you, she kept it because she qualified for it when she didn't have breast cancer, and she saw how well it worked when she got sick. So she kept it for the next 2 years while she was awaiting to get on Medicare. Again, it can be roughly half the cost of an ACA plan. Somebody qualifies for a subsidy? No, probably not, but maybe sometimes. And it'll be, if they don't qualify for a subsidy, it'll be roughly half. And that's kind of what I got. I'm sure you have some questions. I kind of banged through that pretty fast, but I don't know if do we want to go on to Melissa and then do all the questions, or how would you like to do that?
Sure, we don't, we didn't have any questions come in the chat yet. If anybody has any questions, feel free to add them to the chat. This is just an open meeting, so maybe we let Melissa go next. And if anybody at the end wants to unmute and ask a question, we can do that. If you have any questions in the meantime, feel free to enter them into the chat. But we'll let Melissa go next.
Great, thank you. Here we go. First of all, before I get going, I have to say, Monica, that was amazing. What great information that was, and to be able to put that together, and that is a really complex topic. To put it together so clearly and to demonstrate your skill on that, I mean, that was an amazing feat. And for those of you on the line that don't already know finding a person that can speak with that knowledge and service on an individual basis, it's catching lightning in a jar. So that was really impressive. Very good information. Thank you. I learned a lot.
Thank you.
So I have to keep up with Monica. So I think I have do I have a slide going here? I'm not sure that I do. Is my slide up?
Yeah, we have your slide up.
Oh, great. Thank you. Wonderful. Thank you. So I'm going to talk about insurance, but I'm going to talk about the property and casualty side of insurance or business insurance. Primarily, we're going to look at the three basic insurances for a young design firm. That's a business owner's policy, workers' compensation, and professional liability. But it's nice to start with what the motivation for insurance is, because that in large part will guide your decision making. So obviously, nobody wants to pay some sort of medical care on their own. So the need for health insurance, I think, has an obvious motivation. But behind some business insurance, it can be a little murkier. But I really think there are three buckets that firms look to, right? The first and easiest bucket is there some law that requires that you carry a certain type of insurance? And, for our purposes with this line of insurance, there are really only two rules that at law compel you to have insurance. One is if you have an employee. So if you have an employee, you have to have workers' compensation on that individual. Even if they're your employee for 20 minutes, during that 20-minute period, you as the employer have to provide them with workers' compensation coverage. And the other that we're familiar with is if you drive a car, you have to have automobile liability coverage in the state of Illinois. The other insurances aren't required at law. You're free to choose. But there can be, the second bucket can be that there could be some third party that will compel you to purchase a policy. We think about things like if you have, a Canon copy machine and Canon would like you to demonstrate that you have insurance on their property while it's in your office. Or more likely for us, it's a contract, a professional service agreement where your client spells out the types and amounts of insurance that they expect from you. And the last bucket is just simply peace of mind, right? If you have some risk and you don't like the risk, whether it's because of a property that you own or a liability coming in at you from a third party, generally speaking, there should be insurance that you can purchase to transfer the risk onto the insurance company and away from your firm. Now, we will talk about these basic insurances, but there's no limit to the insurances that you can purchase. As your contracts become more complex, or as the firm becomes more complex, there's all sorts of insurance, right? Fly a drone, you can get drone liability coverage. This week, I have been inundated with calls from my architects because there is a governing body that oversees school projects that has added in a quasi request for sexual misconduct insurance, which isn't a typical sort of insurance for a design firm. But we're going to focus in on the three normal insurances. I think I have an illustration here. Oopie. I went too far. There we go. So the first policy is a business owner's policy. Here it's called an office package policy. It's really the commercial equivalent of a homeowner's policy. It packages together two things. It packages together insurance coverage for the stuff you own, if you want to insure it, like your desk and mini fridge and computers from theft, fire, tornado, the sorts of risks plaguing property insurance. And it couples it together with business liability. Now, it's the kind of business liability that absolutely every entity operating in the US needs to have, but it isn't professional liability insurance. With business liability, the single most common illustration of a claim, which won't resonate with you, but the single most common illustration is somebody walks into your office and trips and falls. Kind of like they walk into your home and trip and fall. It's liability coverage. But the important part for a design firm is it covers you where you go. So if you cause harm to someone or damage to something through your action or operations, whether you're at a client office or at a job site, that policy will follow where you go in the US and its territories. From a cost perspective, as a young firm, my expectation is it's probably going to be somewhere around $500 a year. It shouldn't be a significant cost because, the cost follows the risk and you have extraordinarily low risk under that policy. The next insurance is a workers' compensation policy. Most of us are familiar with that, similar to Monica's health insurance, except this is driven by work-related injuries and illness. And the insurance policy itself doesn't set out the terms of the coverage. Whether you buy workers' compensation from CNA or the Hartford or RLI Insurance, it really doesn't matter too much. Their claims handling is a differentiator, but the actual coverage itself is driven by law and not by the insurance company. So, a workers' compensation policy is, that thick because there's not much to say. It's, what Illinois requires, and that's what's covered. Again, you're required to have it if you have any employee at any time. And even if it is just you can get the policy. It's still probably a good idea for you, but you are not required at law to have a workers' compensation policy if you are the sole proprietor, if you are the partner in a partnership, if you are an executive officer, or if you are a member of an LLC. The cost on it is based on payroll. If it's just you, again, my rule of thumb is the cost will be somewhere around $500 a year. That can swing wildly again based on payroll amounts if you're listed as a corporation, but it won't go too much lower than that. And then lastly, there's the professional liability policy. When we think about where claims happen, that's absolutely what we're thinking about. If your risk looked like a pie chart, almost all of it would be covered with professional liability. It's the policy that's going to do the heavy lifting in terms of protecting your firm. The policy itself has a lot of unique features, but I tell you, the one thing that you want to hang on to from this conversation is it's written on a claims made basis. And that's different from how other insurances operate. Other insurances like your car insurance or your homeowners or, workers' compensation, you look at the date of the claim. What date did the claim actually happen? And then you leaf through your records, you find the insurance policy that covered you on that date, and the coverage was memorialized under that policy. But with a claims made policy, the trigger on coverage is when the claim is made. So as that starts to gel, what you naturally start thinking about is, wow, how long do I have to be culpable for a claim, right? Like, how long do I have to carry insurance from the point I render the service? I go back to that early conversation. You don't have to carry it at all unless you have a contract that compels you to. But if your desire is to be covered for the period of time when a claim can be made against you, it varies by state, but in the state of Illinois, it's 14 years. There's a 10-year statute of repose. So that's the period of time that a claimant gets to discover that there was an issue. And then they get 4 years to file from the point of discovery. So the maximum period of time is 14 years. When I give this talk at, with a big audience, now is when I hear a bunch of groans, right? 14 years sounds like a lifetime. But I tell you, it's better than it was before, right? Before it really was a lifetime. So it's one of the few times when the government steps in and gives us a time limitation on a private party claim being made. So it is advantageous, but if you dabble in offering services, you know, we get calls, for example, from individuals that work for, have a full-time job, and they're going to do some moonlighting work, and want to talk about having insurance. You can find an insurance policy for it. You can find professional liability for it. But what you're thinking about now is, will the cost make sense to you? Because while the minimum premium might be, I don't know, $1,400 or $1,500 for a very, very small policy per year, if you now do the math and carry that out over a long period of time to get when those claims can be made against you into the future, when you still have to have a policy, all of a sudden you could be talking about tens of thousands of dollars of insurance cost, and it may not make so much sense. My neighbor has been my client for decades. And she has a part-time practice, and doesn't want any more. And it works nicely, right? She's always got more work coming in to cover the costs that she has for that year, and it makes sense. I think when it really creates more of a, you know, a cost hardship is if it's going to be the one, right? You want to do a job for your, you know, for your neighbor, but you're not going to do more projects. It gets a little bit wonky to maintain the policy, not because you can't get it, but because the cost doesn't always make sense. There are loads and loads of insurers that do professional liability. I think at the last count, there were 50. There was a time in my career, which is long, but there was a time in my career when there were 2 insurers that would offer professional liability insurance to an architect. 2. You know, now we're up to, again, you know, something like 50. But the big names for small firms, RLI, CNA, Travelers, AXA XL, the Hartford, and Hanover, I would say, are really catered to small firms with professional liability. I mentioned a little bit ago that minimum premiums usually don't go below $1,500 or so. In terms of timing on the coverage, for those of you that don't have the insurance, and if you know, when you're in the market, when you're ready to get going on it, you're going to get an application. The application will be vetted, and then hopefully several underwriters will vie for your business, and you know, you'll get results back to consider. Here are a couple words of wisdom about filling out that application. First, if you don't have a history, everything on the application is going to have to be a guess, even though it says, what kinds of work did you do last year? Exactly what sorts of clients did you work with? You'll just have to estimate moving forward 12 months if you don't have the 12-month history to rely on. And use that freedom to choose carefully. We are such an honest and forthcoming group of people that what I tend to see with new firms is, you know, if there's 100 project type possibilities, you know, they put one under each, because who knows, you know, you're going to take whatever comes along, in some cases as a young firm, but really that just creates a lot of confusion for your underwriter who thinks they don't know what they're doing. So, you know, pick a couple of categories, and it isn't a warranty to the coverage. So if you've guessed incorrectly, as long as you guessed as faithfully as you could, there isn't any sort of coverage implication to that. For those of you that are new to the market, the other questions I tend to get are surrounding timing. You know, when do I start thinking about purchasing this coverage, and what does that process look like? The timing on it is up to you. The policy will cover a claim made against you during the period that you buy, which is usually a year. Sometimes you can get 2 or 3 years at one time. It's usually a year, and you're getting coverage for claims arising out of your wrongdoing after the policy starts. So if you really want to be insured for something, don't begin the service until after you've gotten the policy in place. But on the other hand, if you don't have work yet, I wouldn't pre-purchase insurance. Not that you won't as a young firm, but I would wait until you have some certainty around the work moving forward, and then get the insurance in place and go from there. In keeping with that, starting the insurance, the other conundrum can be, how much coverage are you buying? The single most common insurance limit on professional liability for a young firm is $1 million. The $1 million includes everything. It includes the attorney's fees, the court reporters, the forensic consultant on a claim. It's all in. So it sounds like a lot of money, but I am less worried, frankly, that my firms will make $1 million error. And I'm very concerned at the likelihood that you'll get a claim in a jurisdiction where the courts can be moving slowly, or you work on a complex project and there's a whole host of other stakeholders that are involved in this claim, which naturally slows things down. And when things slow down, they cost more, right? The attorney's going to bill more because there's going to be more work in managing that number of people. And again, assuming some complexity on the claim. So the $1 million can easily be used for the expenses on the claim before you ever get around to actually paying the claim itself. The other feature of these policies is that it's an aggregate. So usually, if you're buying a 1 million limit, you buy a 1 million aggregate. So that means that's all you have for all of the claims that are made against you. If there are multiple claims, they all have to draw down from that one bucket that includes expenses and damages. So when you're thinking about purchasing the insurance, as a young firm, the most important thing is you're going to stack up those costs, right? So you look to compare, is it reasonable for me to look at a 1 million limit and maybe a 2 million aggregate? What's the price difference? And how does that impact me? Or it might be a matter of, what is my contract compelling me to do? Or what do I want to look like to firms that I may use my certificate as just a little added marketing bonus? Sometimes you want to, give some appearance of firm size, which can be, improved by having maybe a little bit higher coverage than the norm. And I think I've brought it in at about the 20-minute mark. Is there anything that I can answer, or any questions or stories or comments?
I maybe have a question to start, Melissa. You'd mentioned that even if we have one employee, we have to have workers' compensation for that employee. What if that is like a contract employee through a 1099? Does that still have to have workers' compensation?
That is a great question. So settle in for a minute. So workers' compensation is based on the law. The law requires that if you have an employee, you have to have workers' compensation coverage. But here's the problem. So if you operate with independent contractors, and that independent contractor is injured while working for you on your project, and they think, oh, dang it, I don't have anything else that's going to pay my bills. What am I going to do? Well, one of the things that they can do is they can appeal to the Workers' Compensation Commission in the state of Illinois and appeal this process. They can appeal the fact that really they weren't an independent contractor. They'd like them to be considered as an employee because you managed their day and they used your equipment and they weren't working for other people. It is not a fine point list like the IRS has. My understanding is it's a very subjective process. But if they succeed with that, then if they were your employee, then indeed you should have had workers' compensation on them at the time. So that's the difficulty with an independent contractor. If they don't carry their own workers' compensation, there's always a little bit of risk that you maybe need to get a policy for them. I hate to say this because it's a little odd, but you can't say to that independent contractor, even if you have workers' compensation, hey, Jane, don't worry about it. I got you covered on work comp, because it isn't a matter of what you would like to do or I would like to do or the Hartford Insurance Company would like to do. only matters on whether or not the Workers' Compensation Commission believes that at the time of the injury or illness, that individual was your employee and not your independent contractor. So you can't give them any assurances because we wouldn't know. But from a risk management perspective, Jason, my recommendation to my firms that have independent contractors is that they get a workers' compensation policy. They will be charged for the money they pay that independent contractor as if it was payroll.
Maybe in the same vein, you had mentioned something about like partners in a corporation or partners in an LLC.
Yeah.
If they're not necessarily employees, but partners in the same company.
Yeah. Yeah, absolutely. So the law again requires that employees be covered, but there is a carve out for people that can opt out of workers' compensation and not be subject to the law and rules. And that is a sole proprietor and a sole proprietorship, a partner and a partnership, executive officers in a corporation, or a member of an LLC. So the good news is if you have an LLC and it's only you, and you don't want to purchase workers' compensation coverage and you don't have a contract that compels you to, you're free to make that decision not to have workers' compensation coverage. On the other hand, you can. And you can add in coverage for any of those individuals to a policy. The way the policies are written is generally you're automatically covered if you get a policy unless you have specifically chosen to be excluded from the coverage. But that's the only group. If you have an employee who says, I'm never going to turn in a claim, don't worry about it, they have no choice. They are all employees, once you have a policy, are automatically covered. And if I could yammer on for one more second on this topic, Jason, the other thing that I would say is there is a misunderstanding with principles that goes like this. I'm never going to sue my own company if I get hurt. Why would I waste my money on workers' compensation? And that isn't what it's about, right? You're not suing your company. It's a benefit that you're entitled to. And if you are injured on a job, it's a work-related injury or illness, and you have a workers' compensation policy, it is coverage that you are entitled to. It covers reasonable and necessary medical care. It covers a portion of your lost wages. And if there's a resulting disability, it will give you some, disability payment as well.
We did have a question come in. Is a 1099 employee covered under the firm's professional liability insurance?
I've been waiting to give this answer. Maybe. Right? Is that like a typical insurance answer? It depends on who you're insured with. So if you have a 1099 employee and there is a claim and you have a professional liability policy, the most important thing to remember is you are always covered, right? Your firm is covered. If you hired that individual and you are vicariously responsible for the work that they do, or if it's a subcontractor that you've hired and you get sued, but really it was their error, you are covered under the professional liability policy. The specific question is John or Jane Doe covered? So if the suit names your firm or you and John or Jane Doe as an individual, it would depend on what your policy says. Recently, there's been a real push with these professional liability insurers where they have expanded their coverage to include independent contractors as insureds automatically. But not all of them do. So check in with your insurance professional and they should be able to give you a read on the policy. Many people on this line I happen to know. So if you just send me give me a call or send me an email, I'll be happy to look up your policies.
Okay, we're on a meeting, so if anybody wants to unmute and ask a question, they're free to do that too. I'm going to kind of take over the screen here and put up everybody's contact information again. We didn't have any other questions coming in, so I just wanted to thank everybody again for attending. We'll have another brown bag coming up in another month, hopefully. And thank you again to our speakers, Monica and Melissa, and their contact information is on the screen. Hopefully you can reach out to them and talk to them about health insurance and liability insurance.
Thanks, Jason. Thanks all.